Thank you for joining us virtually for a press briefing. My name is Kelly Chandler. I'm the Public Health Division Manager for Itasca County, and we are hosting press briefings in Itasca every other Thursday to address COVID-19 related issues and questions. And today our focus is on gratefulness as we move into May Mental Health Month. We have speakers who will discuss their experiences with vaccinations and what they are looking forward to post-vaccination. To begin, why do we intentionally focus on gratefulness? Research shows that when we focus on what is good, our mental and physical health improves. Our sleep, our relationships, our communication, self-esteem, and mood all improve. We're less likely to be angry or aggressive. Intentionally focusing on what is good costs us nothing, but has great returns. Together with our Arrowhead public and tribal health partners, we're engaging in a hashtag Gratitude Attitude MN challenge. We want our community to post videos or statements about what they are grateful for on social media and post it to their sites with, again, hashtag Gratitude Attitude Minnesota tag to share and spread what is good with others. And we do have so much to be grateful for over a year into this global pandemic. We have 3 vaccines that are approved within the United States, which provides 100% effectiveness against death from COVID. And with these great vaccines, we have the ability to reach herd immunity, which is to have enough people with immunity to the vaccine to not spread this infectious disease amongst our families, friends, and neighbors. Think about when polio came, things did shut down until we had a vaccine. Now we are at herd immunity in the United States with polio. But to reach herd immunity, we need 70 to 80% of our population to receive the vaccine. And so far, we're at about 50% of our eligible population vaccinated. So we do have a way to go in Itasca. We do not know the long-term effects of contracting COVID, and we are seeing people be reinfected more than once. But what we do know is the vaccines are effective and will not cause unnecessary illness and use of our healthcare resources. Currently, anyone 16 and up can be vaccinated against COVID-19, and within a few weeks, that will move to anyone 12 and up. Our pharmacies, clinics, and public health are all vaccinating for COVID-19. If anyone is struggling to register or find a, please call public health at 218-327-6784. That is our COVID message line, and a public health team member will return the call and assist you with accessing a vaccine. And for anyone who's homebound or otherwise has barriers to getting into a clinic, please call that same message line and public health will make arrangements to get a vaccine to you. One of the common questions regarding vaccinations is whether or not you can still contract COVID. I personally know 3 people locally who have tested positive for COVID post-vaccination. That's out of over 18,000 people. They were not hospitalized or significantly ill at all. So is it possible to test positive after vaccination? Yes. Is it common? Absolutely not. As of March 26th in Minnesota, 89 persons had tested positive for COVID post-vaccination, and that was out of 800,000 people who were fully vaccinated. That is well less than 1% of infection rate. Vaccines are 95% effective in preventing illness, and as of late March, we were seeing well below that in Minnesota and in Itasca. As of last week, the Johnson & Johnson pause was lifted. 6 women out of 6.8 million vaccinated had developed a blood clot, a rare but serious blood clot related to the vaccine. The CDC and FDA paused as a precautionary measure to identify any further cases and to further research the vaccine safety. And this is a good thing. It really shows our surveillance and safety systems in the United States are working. What was determined is the benefits of the vaccine outweigh the risks, and use of Johnson & Johnson is now resumed. In Itasca, there's a small amount of this vaccine available for select groups. We're still waiting to hear more on future allocations of this vaccine for the general public to Itasca County. In the past week, we've identified 152 new cases of COVID in Itasca residents and 332 new cases in the past 14 days. We have lost 53 of our Itasca residents to COVID since the beginning of this pandemic in March of 2020. As much as we are all anxious to get back to what will be the new normal post-pandemic, please stay strong, stay 6 feet apart from others. Our schools are working to stay in person for the remainder of the school year. They want to host proms, they want to host graduations. Our businesses want to stay open and even be able to open up their capacity further. And we're so grateful for all of you in Itasca who continue to do their part to slow the spread of COVID while we are working to get our neighbors vaccinated. I will now introduce our speakers. We will hear from Sam Dwyer, PharmD, Acute Care Pharmacist, Essentia Health Deer River, Luke St. Germain, County Veteran Service Officer for Itasca County, and Noah Wilcox, President, CEO, and Chairman, Grand Rapids State Bank. We will now hear from Sam Dwyer.
Thank you for the introduction, Kelly, and good morning all. I'm Sam, I'm a pharmacist at Essentia Health, and I chose to get vaccinated to help protect others as well as myself. My wife and I reviewed the vaccines once they were approved by the FDA under emergency use authorization. And we also looked into fertility concerns since we saw some things circulating on the internet, and I reached out to trusted medical experts and saw no concerns. And my wife and I actually did not have any concerns with fertility, as we're happy to say that she is pregnant. So we kind of put that concern away. I would encourage others to consider what they can reasonably do to keep us safe, as we all desire a return to a new sense of normalcy. The vaccine is one tool that we have in the toolkit to fight this virus. And as we move through the pandemic, we've seen that the virus can shift to continue infecting individuals. We've seen an increase in cases in the adults of childbearing age and also children. The elder adults led the way in being fully vaccinated. And now it's our turn as the younger generations, as we're able to receive the vaccine now through the priority group. So it's our turn to follow suit, the leadership of the oldest generations in getting vaccinated, because that's one way I believe we can keep each other safe as we try to establish a new sense of normalcy and keep our children in school, keep our businesses open, and all of us working together on site, since we really enjoy being together as a community. And we've all missed a part of that over the past year. And that's really what I look forward to the most, is we are hopefully able to continue moving towards herd immunity, which will allow all of us to see our smiling faces together and meeting in person once again. So thank you for doing what you can reasonably do and considering becoming vaccinated as we all move forward through this pandemic together.
Thank you. And we'll now hear from Luke St. Germain, County Veteran Service Officer in Itasca.
Hello, everyone. Thanks, Kelly, for that introduction. I primarily chose to get the vaccination through public health when it became available, primarily by being a public employee. I work with our local veterans. We have about 4,000 veterans in our county, and a good majority of them are 65 and older. So I really felt the need to get the vaccine to protect those that I'm serving on a daily basis. Despite all the opinions that are out there, I can't pretend that I did a lot of research on my own. I would say that I felt more comfortable just with my past experiences being an Air Force medic for 10 years, working in a family practice setting. Through that experience, I grew to have a deep respect for our medical providers. They're much more educated than I am, so I don't know how much my research would have done for me. So I do have faith in our medical providers and want to follow their advice. Also, being a military person, I received lots of vaccines in the past, so I figured what's one more. Last summer, my family, we spent a lot of time on the pontoon boat. I have 3 children, 7 and under. So a lot didn't change for us because we're homebodies with little children. Of course, we're cautious about large gatherings and really stuck to just the family stuff. This summer, I think we're going to be doing that again. Don't really have any big plans to be doing anything out in the public, but we're just looking forward to another summer on the lake. Moving forward, continue to mask up as needed. We are appointments only at the Veterans Office, trying to limit how many people come in here and cleaning up after people leave. And then, of course, staying cognizant about large gatherings. We are seeing much of our community, they're going to be doing Memorial Day events at cemeteries. So we ask community to respect social distancing, maintaining that space between each other, and masking up, of course. My advice is, if you're seeking vaccination, there's plenty of opportunities in our local community. And if you're a veteran, the VA has plenty of supplies to get you vaccinated. If you need help with enrolling into VA healthcare, you can do that with my office by scheduling an appointment with us at 218-327-2858. Thank you.
Well, good
Thanks,
morning,
Lou.
everybody.
Go ahead, Noah.
I had a bit of a journey to get to my vaccination. In March 12th of 2020, I was leaving what I think maybe was the last large-scale convention in the country in Orlando, Florida. And when I left the hotel, all the restaurants, all the shops were closed. The hotel was a complete ghost town. Nobody in the convention center. The airport was empty. And that's the last time I've been on an airplane. I typically travel between 190 and 200 days a year. So very, very strange. On March 15th, that following Sunday, we made the decision to close our lobbies by appointment only, which is the first time that's been done in the nearly 107 years of existence of our company. And we did that because we really are one of the front porches of the community in Grand Rapids, and we welcome hundreds of people through our doors every day. And that decision was made to try to slow the spread and be responsible. And really a bit of a nerve-wracking decision, but was very welcomed by the community, and we're still receiving positive comments in that regard. Of course, we have pretty much every age category that works for us, lots of people with underlying health conditions, and we wanted to keep the staff safe so we could continue operations to support the community and those that bank with us. And then really started to study the science and follow the vaccines, and talking to my medical friends and my pharmacist friends and anybody else that we could get information from to try and understand what we can do to preserve public health in the best way that we can as sort of a community steward. I'm not a guy that gets flu shots. Of course, I've had all my vaccinations as a young child. This thing's different, and I'm, you can see by the flag behind me, I'm a huge patriot for this country. And I really came to the conclusion that it's part of my obligation to the country, part of my patriotic duty to help reach herd immunity and to get this vaccination. And so when I had the opportunity to do that, I did. My wife and I very enthusiastically did. And, I think you realize that you actually carry some anxiety that you don't understand until you get that first shot. I was like, whew, a weight off your shoulders, and even more so when you're 2 weeks past that second shot. So our whole family's been vaccinated, all of our kids, including our 16-year-old twins. And there's lots of reasons besides patriotic duty. We want to help slow the spread of the disease. We have family members that have significant health complications and underlying conditions that we haven't been able to see for a long time, and now we can, and we look forward to that. Hope to get back out on the road at some point soon. I'm tired of not being able to see people smile. I'm grateful when I get to see people smile. So it's one of those things, and I know that we're seeing rising cases right now. And just really encourage people to put the mask on. It's a simple thing to do. And I know that everybody's fatigued. I'm fatigued, but I find myself walking around with it sometimes when I don't need it on, because you just forget it's there. It's not that hard to do. And we can slow this down and keep people safe. And it's tragic that we've lost 53 Itasca area residents to this disease. And I would hope that we can not lose any more. But it's going to take everybody to do their part, and it's a small part to do to get this under control for the long haul. If you're skeptical, this is just the science talks. I mean, I'm tired of people making the vaccine political. It doesn't have it doesn't discriminate. It doesn't care if you're a Republican, an independent, a Democrat, or anybody else. This thing will strike. I mean, I know very healthy people that are far younger than me that have been so sick and near death that it's not even funny. We've known people that have passed because of the disease. It's touched our lives in a way that I can't express. And, you know, get the shot and help our country heal and help our country move forward.
Thanks so much. And we'll now move to the question and answer portion of our briefing. And we just ask our media to put your name in the chat and the organization you represent and ask your questions. We'll ask our speakers to respond. Okay, I am seeing no questions, so we'll end this briefing early. Thanks so much to all of our Itasca residents for doing your part. Stay strong and seek out your vaccinations. Thanks, everyone.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.